Well, because I feel like he saved my life. I feel like Dr. Stahl and Dr. Olson, my cardiologist, they saved my life.
Yeah. Did it take heart disease, this question I'm going to keep coming back to with all of you on the panel, did it take heart disease to get you to change the way you live? Did it have to get that serious?
I guess it, you know, I thought it might probably happen to me because of my family history, but then you think that it won't happen to you. But then when it did, it just knocked the wind right out of my sails.
Yeah, yeah.
And so it, well, it helped me to make changes in my life that maybe I wouldn't have done.
Okay, that makes one of the points I think we want to make tonight. You don't mind us making such an example out of you, do you?
No.
Well, we're going to be doing. We're going to be doing and the doors are locked.
Okay. All right.
We'll get back to you soon. Okay. Thank you, Ellie. Let's go back to our panel. I'd like you to meet Janet Townsend. Janet, tell us about yourself, what work you do, and what you have gotten out of today, if anything.
Well, I'm a family doctor and worked for a long time in New York City, where we also have a lot of people who are overweight and don't walk around enough. I've come here to work at the medical school, and so I'm very involved in teaching the future doctors and other health professionals. I think from today, what really struck home is how serious this epidemic is and how we all really have to work together. I think we shared a lot of practical advice, how in the community, in doctors' offices, in hallways and in practices we can begin to advise patients to make changes that they can to avoid some of these bad consequences.
I'm going to put you on the spot.
Okay.
You could have said that last week, last month, last year. Did anything happen here today with Catch 10? We should describe what Catch 10 is, and we'll do that in a moment. Did you pick up anything today, or did you see anybody who's here with us in the theater, any of these medical professionals? Did a light go off for anybody?
Well, I hope so. What we were trying to do is to think about ways that are really practical in our busy lives. I think we talked about how we as health professionals need to be good role models and really make the room in our own lives and our practices for our staff to act in a healthy way, and then to empower every single member of our staff to be interacting with patients constantly, so that patients like Ellie don't have to experience what I'm sure was a very difficult time of going through surgery. So I think I felt a different sense of commitment of paying attention to this, and and we identified a number of ways that were pretty practical that we could do it, you know, such as having everybody in the office staff discuss this with patients.
Okay. Dr. Voice, Dr. Stephen Voice, Chief of Cardiology, Moses Taylor Hospital. As I joked earlier, I stuck my head in and you were giving a lecture and you were speaking Swahili. But these folks here all understood it, I presume. Let me come back to the Ellie question, and then we'll talk about what you do. Ellie is an example, evidently, of somebody for whom it took a medical crisis, open heart surgery, to change her lifestyle. It took that to get through to her. Is that what we're all to face? Do we all have to face that? Do we have to face that to get serious?
Well, hopefully not. A lot of times it does take a crisis to affect a permanent or long-standing change. One of the issues, and one of the things I think is very important, and I mentioned earlier, I think it's very important to recognize that you're looking at a cardiac surgeon, primary care physicians, cardiologists here. We typically see the patients towards the end, at that time of crisis, having a heart attack, needing bypass surgery, needing an angioplasty or stent type of procedure. What we really want to do is try and pull the clock back and try and affect changes that occur at a much earlier period of time before the individual person gets to the point of needing our services on such an acute basis.
Let's try to get to the emotion, if we can. You're all scientists. I mean, that's what you are. And yet you must be very human at times. You have to be. You have patients. You care for them. You take care of them. What is the hardest part? And this is an unfair question, but what is the hardest part to a physician conveying news so serious as advanced heart disease when people don't see it coming?
It's very difficult. I think individual patients find that heart attack, and certainly historically, heart attack was a major life-threatening illness. The risks of having a heart attack have gone down with some of the technologies we use, but it clearly is a life-changing event. They may not be able to be as active as before. Things certainly have to change. They'll be on medications where they may not have been on medicines before. Those types of things are major changes. To deal with the patient as well as the family, because a lot of times it involves the entire family, changes when perhaps the breadwinner in the family becomes afflicted with the illness, that changes the entire family dynamic. We're docs, we're scientists, but we're also fathers, wives, children, parents. So we're affected very much the same as others. I think most of us here probably have some family member that's been affected by cardiac disease.
I'm going to tell you my own story in a moment, but you mentioned something very interesting there. You said that today, heart disease is easier to prevent because of technology. The title of your seminars, and I believe this is the 7th in a row, CATCH. It is Convergence Around Technologies for Cardiovascular Health. So has indeed technology played a profound role for doctors in preventing heart disease? And could you give us an example that we can all understand?
Well, certainly in treating heart disease, it has helped tremendously. The surgery Dr. Stahl performs, the blood tests that we're able to get at primary care offices, the imaging procedures that are able to be done, CT scans, angiograms, et cetera, that can detect disease at earlier points in time. Some of the treatments that we do as cardiologists, fixing blocked up arteries, has clearly changed. I think one of the things that's interesting with CATCH this time is that we're going beyond just the technology now, and we're going to try to affect lifestyle changes and go to the grassroots of it more, I think, to speak more frankly.
Okay, I think this is where Donna comes in, lifestyle changes. Donna Scott is a nutritionist and personal trainer. I'm told you're very serious as a personal trainer, and I can't tell you who told me that. Tell us about yourself. What do you do, and what difference do you make for people who've tuned in worried, scared to death about heart disease?
Well, I'm a registered licensed dietitian in Pennsylvania, and I don't follow the same algorithm of, here's a diet, this is what you need to do, you just need to lose weight, get it done. It's more of, in society today, we can't do that. We look at technologies, we've had advanced technologies both in medicine as well as in society in general with technology and electronics, and we've become more of a sedentary lifestyle that we have. So what we need to do is take a look at that and revamp our eating around it and revamp our lifestyle and take time to make it a point to not only schedule things for the day's events, but schedule our time too. And schedule our time for us to take care of ourselves, because we shouldn't have to wait for the wake-up call. The wake-up call of, having the chest pain at night or the acute. When all the markers are there, we shouldn't have to wait for the wake-up call.
Okay, let's play out a test case, a case study, if you will. How does somebody get in touch with Donna Scott? I don't mean your phone number. I mean, under what circumstances? No, I'm not being funny. Under what circumstances would a patient who maybe goes to Dr. Stahl, how did they find themselves working with Donna Scott?
Well, what usually happens is a referral. Dr. Stahl and his nurses and his staff are very supportive in trying to educate the patient, but when they find that they're getting a stumbling block, they can just refer out. Sometimes people can be quick fixed and be given the simple direction of you need to decrease your fat, increase your activity, and you have some motivated people who'll do that. Others, they won't. So to answer your question, just a referral.
Okay. Yeah, okay. At what point in your practice, if you will, do you surrender and say, I can't help this person?
When they don't want to help themselves. But I don't even quit then, because then I get the family to gang up on us. But it's more of a supportive way, because at the end of the day, they have to look at, I don't come from the traditional aspect of, you need to follow this, have a nice day, I'll see you in 6 weeks. It's more of, this is what you need to do to change your lifestyle. You need to change your lifestyle. It's not a diet. It has to be important enough to you. But if your life is not important enough to you, I need to know that. And then if I get the response it's not, I then go to the family member and then work. Because at the end of the day, they think the burden is they think they need to make this 180-degree change in their life